such a congressman show up and be a part of our communities, and be at our functions, and be at our events, and how proud we are of him. I want to thank FreedomWorks for what they're doing here today, and for allowing me just a few minutes, a few seconds to speak. If any of you folks are interested in being a chief judge or judge at the precinct level on election day, please see me after this event. Please see me, chief judge or judge. Thank you for your time.
Now, since we're running on a pretty tight schedule, I want you to meet Dean Clancy from FreedomWorks, Vice President of FreedomWorks. You want to come on up, Dean, and he will introduce our speaker.
Thanks, everyone. I'm Dean Clancy from FreedomWorks out of Washington, D.C. It's delightful to be here in Hendersonville, North Carolina. I love North Carolina and this part of the country and all these wonderful patriots that I'm getting to meet here today. And I love working with Alan Page, the gentleman in the red polo shirt, who is our man on the ground here. And it's a real honor to be here with Congressman Mark Meadows. We at FreedomWorks have had the honor of working with him on a project we call the New Fair Deal, a positive reform agenda for America's future, a little more libertarian, a little more populist, a little more freedom-oriented than what you sometimes hear from Republicans. And he has been a very enthusiastic cooperator with the grassroots on the New Fair Deal. We're also absolutely delighted by what he is doing to defund Obamacare. Congressman Meadows needs no introduction with this crowd, so I won't bore you any further. But I do want to say, Congressman Meadows, on behalf of the more than 6 million Americans who believe in individual liberty and constitutionally limited government and are part of FreedomWorks Network, and especially on behalf of the more than 50,000 FreedomWorks members in North Carolina, thank you for all you do for freedom in America.
One thing I'm proud of is for the letter you wrote about Obamacare.
Well, thank you so much. I don't always get this great of a response. So it's a wonderful time. And, it's good to see, well, Eve Greg, it's good to see you back. I tell you what, I'm going to shout out. It's so good to have you back with us. It is an honor for me to be here and to represent you, but more importantly, it is an honor to join you in the fight that we know must be won to preserve our freedom. And I just say thank you so much. So many of you have been strong advocates in terms of fighting for freedom. But the other part of it is when you fight, it is not without a cost. And I can tell you that the encouragement that I get from so many here in this room has lifted me and my family up. You know, when you really look at it, when you fight the fight, all of a sudden there are those out there that believe that you do not love liberty, that you do not love your neighbor, that you're not fighting for the right reason. I can tell you the reason why we are fighting this fight. It is for freedom and for the people in this room and the people in this great country to make sure that we build back our walls and make sure that we have a land that truly honors the Constitution and protects all Americans. And that's why I'm here. We have a number of town halls, as you might have been reading, and as we go across this particular district, Andrew, Mr. Chairman, thank you so much for your kind words. I don't believe in cloning, but if I did, I would clone myself so we could actually be in a number of different places at the same time. But we have to leave from here to go to a town hall meeting in Graham County. Then from Graham County, we have a town hall meeting in Macon. We will be back here this coming Friday, so please, if you will come to the town hall meeting this Friday, because when I signed up to run for office, it was not just to represent a few people. It was to represent 749,000 people in Western North Carolina as their representative. And what happens is, when you represent them, you have an obligation to hear from them. And we want to make ourselves available. I share the story often where we have gone out and we have voted based on the number of calls and the number of emails and the number of people that have called our office and said, this is the way that we want you to vote. I was on the phone with a reporter. I shared this story yesterday. I was on the phone with a reporter one morning. And she was doing an interview, and as she was interviewing me, she says, well, you've got this important vote that's coming up today. How are you going to vote? And I said, well, I'm not really sure. I haven't made up my mind yet. And so as we were continuing on with the interview, what happened is the bell goes off, and there where you're sitting there, the bell goes off. It's time to go vote. I said, well, I'm afraid I'm going to have to cut this short because I'm going to go over and vote. And she goes, well, how are you going to vote? I said, I'm not sure. I'm going out into the next room where they're counting the number of people who have called, the emails that we have, and I will vote the way that the people said to vote. And that is a representative form of government. We're here to talk about Obamacare, and we're here to talk about why it needs to be defunded and not implemented. And I can tell you the reason why that is because, as Nancy Pelosi said, eventually once you pass it, you have to read it. And we are now reading it to find out that what it promised is not what it will be delivering. And we have got to make sure that we change that. So here are some things that was promised that Obamacare is not doing. We promised lower premiums. Do you remember that? I mean, we were promised lower premiums, and what we're finding out now is not only are we not getting lower premiums, but we're getting much higher premiums. We were promised that everybody in America would have health insurance. Weren't we promised that? Well, we know now that we will have some 31 million people still without health insurance. 31 million people, guys. We only have 50 million that are without it now. And so we're still going to end up with 31 million people. So we're not getting lower rates. We're not getting everybody covered. And then all of a sudden what we said, well, it would cap your out-of-pocket expenses. Well, we found out in the last couple of weeks, well, it's not going to cap our out-of-pocket expenses, at least for the next year or so. But don't fret, because employers are going to have to make sure that they provide health insurance for everybody, and so everybody will be covered. But, well, hold on just a minute. We're not going to make the employers do it. We've delayed that mandate, but yet we're making sure that everybody still has to go out and pay for insurance. Now, what does that mean for people here in North Carolina? It means that healthy people, those who may not have purchased health insurance, they could purchase it today for one price, or they can purchase it next year for a much higher price. But not only do they purchase it for a higher price, they have to purchase it. Because you know what? We're not being fair about it. If we're going to delay the employer mandate, don't you think we ought to delay the individual mandate as well? I tell you, Obamacare is not ready, and it's not fair the way it's being implemented. And we need to make sure that we trumpet that message over and over. It's not ready, and it's certainly not fair. So many of you, we have about 77 of my colleagues that have signed on this letter that ask for us to defund Obamacare. We have voted some 40 times for repeal, and some people ask me, well, why is this different? Well, the difference is if we put this particular language in whatever funds the government going forward, it has to have a vote in the Senate. in order for funding to go. The 40 times that we've had before, they can just say, well, thank you, House, we're glad that we're going to do it. But September 30th, we're going to have to vote to say what we're going to do for funding for next year's funding requirements. And so that's why the Senate will actually have to take it up. Don't you think it would be good for Kay Hagan to take a vote and let us know exactly where she stands on this? Don't you think? I think it's time that she speaks up. But I can tell you that we will not be successful without the voices of people here in this room. Because when you get together and you continue to share with those that you have elected, you know, Ronald Reagan had a great line, and I love a lot of my Ronald Reagan quotes. But this is one of my favorites. He said, well, if you can't make them see the light, you need to make them feel the heat. And I think what we have to do as a people is make sure that our elected officials feel the heat. And so I'm encouraging you to call members of Congress to express the fact that you don't want it. I can tell you that the number one thing that I expected to hear when I came back to the district from Washington, D.C. was how this was not a good idea. But actually, I've heard just the opposite. Over and over and over again, I've heard people who say we must find a way to stop Obamacare. And why should we have to do that? Because it's going to hurt seniors, it's going to hurt the middle class, it's going to hurt families, and lastly, it's going to hurt our freedoms. You know, I can't think of any particular federal agency that does things very efficiently. And if you think about it, a lot of those federal agencies, there's always a line that goes along with that. You know, so I asked a group yesterday, do we want the Veterans Administration to administer Obamacare? Well, no, because you know why? We've got our veterans, many of them waiting over 600 days to get claims filed for disability. It's a shame, and we can't, so the government's not doing that well. So do we want the EPA to look over it? We have a site here in Buncombe County called the CTS site where we have contamination that's been there since 1989. It is still not clean, it is still contaminating, it is still harming people, and yet what we're doing is, when I talked to the EPA the other day, they said, well, we may be able to get it cleaned up in another 4 to 5 years. Guys, that's 20-something years. You think that we could do better than that. So who else do we want to get to implement it? The IRS? So do we want to get the IRS to implement this when it took them over 3 years to make a determination on some 501c4s just because they happen to have 912 or Tea Party in their name? It took them 3 years. And you know, we have got to find a way to make sure that we allow the free market to provide health care. I'm all about covering pre-existing conditions. I'm all about making sure people get covered, but the free market can always do it more effectively than the government. And I'm going to close with this, because our president has said that we just need to tweak it a little bit. That's what he said. We just need to tweak it a little bit. Now, the tweaks that I'm seeing, there's going to be a whole lot more tweaks that we need to do. But he likened it to an iPad or an iPhone. He said, you know, even when they came out, you know, they needed a few little tweaks. There's a big difference between that and healthcare. Because if you have a glitch on an iPhone, maybe your app doesn't work, and maybe the game that you're playing on says game over. But when you're dealing with healthcare, game over has a totally different meaning, and we need to make sure that we keep healthcare between a doctor and a patient, not a government. I'm committed to work with you, and I'm committed to listen to any great strategy that will save this great land. Right now, the only strategy I know that will work is one that defunds Obamacare. But I'm a business guy, and I'm willing to listen to great strategies that perhaps will work. If you hear of one, let us know. But the other thing that I want to say is when the people of this great country, when they speak up and let their voice be heard, it will never be drowned out. It will always prevail. And I can say it's an honor to serve you. Thank you so much for the encouragement. This is a huge encouragement. I will take this energy and run the rest of the 2 weeks as we hit another 7 town hall meetings that may not be quite as positive as this one. All right. God bless you. Thank you so much. It's an honor to be here. For some questions, is that correct? Okay, and Jenny, I saw your hand go up first, and then I'll come back.
Just real quick, what is Boehner and Cantor's temperature at the moment on this?
The question is what is Speaker Boehner and Leader Cantor's? Let me. What the strategy is, I'm not sure in terms of answering that. But I do want to say that we are united in trying to make sure that we can do whatever we can to make sure that Obamacare is not implemented. Now, does that mean that they are necessarily for a defund shutting down the government? Let me just tell you, the person who's talking about shutting down the government more than anybody else are the Democrats and the president. And guys, what we're doing is I want to make sure that Social Security checks continue to go out, Medicare continues to get paid, our military continues to get paid. It's not about that. This is one specific area that we continue to get requests over and over for money. And so I've talked to a number of my colleagues in the last couple of days. The momentum is growing. You may read that it's not, but the momentum is growing. And I believe that we're committed to finding a way to make sure that Obama is not there. Not the president, but Obamacare. Excuse me. I had one over here, and then I'll come to you. Yes.
Hi, Mark. First of all, I want to thank you for the fight that you've taken on in D.C. I know it's tough. You go inside the Beltway, and it really changes. And a lot of people press flesh with you and want you part of their agenda. So I appreciate you being willing to stay an outsider and fight, because it's a tough crowd that you're in, and we understand that. I'm a small business guy here. I'm a real estate agent, also have a small business. And I guess mine's more of a comment, just something to take back with you as food for thought for Washington. Currently, my family spends close to $5,000 a year for health insurance that we pay out of pocket. There's nobody there to pay it. We pay it ourselves. We make our choices. And it's my understanding from Blue Cross Blue Shield that we're going to see a percentage that won't tell us how much. But we're at the position where we're going to be forced in November, December, January. They're going to put us in a position where I'm going to have to make a decision to just not have insurance for my family. So I'm going to go from providing for insurance for my family to not providing because of Obamacare. And I guess the question I would leave is, how can we expect the IRS to handle our health care when they can't even manage their own house?
Yeah.
It's ridiculous. We appreciate your fight.
Well, I appreciate your comments, and when we look at implementation, I was in a hearing where we were talking with the IRS about this $4 million conference that they have, where they had the luxury suites. And I read in the report with the Inspector General at that particular time that they could not actually get the actual cost of that conference. And I found that very ironic. Here's the IRS who wants to make sure that you have every receipt for everything that you do. And by the way, keep your receipt today. No, but they want to make sure that you have every single receipt. And yet here was the IRS who could not give enough receipts to tell what the conference cost. So the conference was estimated to be $4.1 million. And so I asked the guy that was in charge, I said, could it have been $5 million? And he said, yes. I said, well, could it have been $6 million? Well, I don't think so. But the truth of the matter is almost 20% of the receipts they couldn't find. Now, this is very problematic for somebody that's going to be over your health care for implementing it. If they can't even keep track of conference where you'd assume that they used a charge card or some check or something went out, you'd find that. But this is the same government, guys, that last year spent $107 billion. That's billion with a B. They spent that kind of money and they don't know where it went. Now, this is very problematic, and so when you're starting to deal with your health care, we need to make sure. Stories like yours help. I was at a pharmacy earlier this morning, and they were sharing how that literally the cost of pharmaceuticals, because of the government regulations and the way that Medicare and Medicaid have come in, and with Obamacare, they're going to make it where it is very difficult for your average pharmacy to stay in business. And so we'll end up getting our pharmaceuticals from the government. You know, and so I'm very concerned, and we need to continue to share stories. The more that you put the light on this particular problem, the more you realize that it's not ready for prime time. Yes, and I promised her, and then I'll come to you and back around. Yes.
Mark, I'd like to ask you your feelings and those of the House and anybody else that you may come into contact with. If Obamacare is so wonderful, why are they exempting all these people who shouldn't be exempted?
All right, the question is, if Obamacare is so wonderful, why do they continue to exempt and give waivers? The other part of that question is this is a program that was supposed to be so wonderful that it would sell itself. Now, how much are we spending to sell Obamacare? $700 million that we're about to embark on to make sure that we can convince people that what they're about to buy is really a good deal. And that sounds like a massive marketing effort. In fact, it is. That's about the same amount of money that we spent on a campaign that just elected a president. You know, when we start to look at it, $700 million. So you're about to see ads that are trying to change public opinion. And what we have to do is call it out for what it is and start to share the stories that he's got coverage today. And there's a good chance that he won't have coverage anymore because of this. And realize that it's not that popular.
Who's
And why
going to
give
pay for
waivers?
all the people that are being exempted?
Well, the ones that pay for all the people that are being exempted, many of them are sitting in this room. You know, when you look at 12.1 million people, 12.1 million people will either get free insurance or a subsidy under this new Obamacare. That's a cost that comes out of the taxpayer, hardworking taxpayers' pockets, or out of Medicare to pay for that. And that's my concern. It's a good point. Yes, Ron.
IPAB, Independent Payment Advisory Board, any chance it'll be killed? That's the death panel, folks. Any chance it'll be killed?
Well, we have some of our colleagues that are Democrats that say what they want to do is work with us to make Obamacare better. And the best way that we can do that is to get an independent board who's going to make health care decisions. And they say that it's not going to ration health care. But I don't know how you would go about making an independent payment board figure out who gets health care and who doesn't without rationing. And so normally the way that you would look at doing that is perhaps not ration it, but you would tell the hospital or the doctor, if you do that procedure, you're not going to get reimbursed. I mean, and so it's de facto rationing when we look at that. I'm for getting rid of all of Obamacare. And if we're not successful there, we certainly need to get rid of the Independent Payment Advisory
Am I
Board.
correct, they have no docs on that board? It's all going to be appointed
You know,
bureaucrats?
That is correct.
They're appointed with no doctors on there.
Perfect.
And so we've got to make sure that we get rid of that. And it's troubling because we're changing the way, you know, everybody looks at healthcare everywhere else, and as bad as some may say our system is, there's still lots of jets that fly in to America on a yearly basis to get health care here because we have the greatest physicians and the greatest hospitals and the greatest health care in the world. Yes, sir.
My name is Richard Jennings, pastor of Joy Outreach Fellowship in Transylvania County. I do have an observation. My son needed an MRI last month with insurance at our Transylvania County Hospital. His cost was going to be over $2,000. He went to Asheville to an open clinic kind of thing, a free enterprise thing, $425 cash that day. What's the difference between the two? It's that bureaucracy and all the handouts and the money that goes through the system.
Well,
That's my observation.
and thank you for sharing that, but thank you also for answering the call to pastor, you know, and truly, it's.
My wife and I pastor together.
Well, thank you both for answering that call. It's really, it changes the hearts and minds of people, and I just appreciate you doing that. But when regulations come in, typically what they do is they make things more difficult to get, so there's lines. They can make them more expensive, not less expensive. I was appalled today to find that there is a certain prescription behind the counter that is $20 if you are on a certain type of government program, and out front that they won't offer the one behind the counter, but out front the same person purchasing that with private insurance pays 3 times the amount. And it's the same thing, one behind the counter, one, and it's the way that we have. The other is the drug companies actually do not allow the pharmacists to sell generics to Medicaid patients because they get a kickback on the brand name instead of the generic on that particular. You know, the more you get into it, the more you realize that we've got problems. Don.
I'd like to call to your attention that the VA charges for a 90-day supply of a prescription $27. I go to Walmart and pay for the same 90-day $9. I do split it because they're not always cheaper than the VA. But there is a 33% not saving, it's a 66% saving for a prescription.
Well, Don, it's interesting that you shared that, because this morning, as I was meeting with this pharmacist, he showed me real numbers. He said, if you're on a particular program, all right, here is what I have to charge, and it was $27. He says, now, if you're not on this program, I can sell it to you for $4.95. All right. So what happens is when we get in, we create false markets. We pick winners and losers. We go there, and what happens is then we're constantly trying to figure out another way to make it work. And since we're talking about healthcare, let's go ahead and put this in a vernacular that you might understand. When we start looking at tax reform and the benefits and how we fix system, we continue to add layer upon layer upon layer upon layer. It's kind of like your doctor giving you a prescription. And he says, well, gosh, my arm's hurt. So they give you another prescription. And you say, well, you know, I've got this other problem. And so they give you another. And before long, you've got 6 or 7 or 10 different pills that you're taking that were all prescribed for a particular thing. But the side effects of each one of those things may be counteracting the drugs, the very drugs that they prescribe to help you. Yeah. That's what we're doing as a government. We're well-intentioned, but the benefits are not there, guys, because the unintended consequences that we continue to see continue to hurt the American people, and we need to make sure that we start over. Yes, Mr. White.
I have a quick question. I heard recently that Congress and congressional staffs are going to be exempted now, and how did that happen, and what are your thoughts on that?
Okay, next question. Now, I appreciate you bringing it up, and it's something that we found just the other day, that the administration said that they were going to go ahead and exempt folks and allow them to get a subsidy in congressional staff. And I can tell you that immediately we got together with our staff. I've got some of the best staff that truly loves the people they serve. That's their #1 calling. And they got together along with Kenny, our chief of staff, and a number, and said, you know, this has come down the pike. What we have got to figure out is a way to make sure that we don't have one standard while they have a different standard back home. We are never going to have it. So much so that all of our staff, every single one of them, are willing to give up the subsidy which could cost $2,000 to $3,000 a year to those employees, every single one of them are willing to give that up because they know that we need to be under the same standard that you're under here, and that it is time that we get rid of hypocrisy. And I'm coming here and I'll come to you. Yes.
You don't have to give a lot of detail. Is Benghazi going to be swept under the carpet?
No, Benghazi is not being swept under the carpet. We are continuing to do investigations. I'm on the Oversight and Government Reform Committee, and I can tell you that we're going to get to the bottom of it. It's not politics. We have 4 dead Americans. It's time that justice is brought forth and people are held accountable.
Right.
One
last question that I'm getting, and so I promised over here, did I not?
Yes,
Okay.
thank you. Could you lay out the strategy going forward for the votes that are going to happen? You've got a vote in the House to hopefully defund Obamacare. Then it goes on to the Senate, and you're obligating the Senate to vote on it? Is that what I heard you say?
Well,
earlier?
here's what happens.
And then what happens?
A great question, because people get all of this kind of bound together. On September 30th, funding for our government needs a new appropriation. Typically, the way that that's been done over the last few years has been what they call a continuing resolution, which I'm not in favor of. I think we need to have regular order where we have appropriations bills for each one of the categories, and then you pass it, you debate it, and you do that. However, there's only been 4 of those that have been passed in the House to date. There's not enough time between now and September 30th to pass the others. Even if we did, getting agreement with those in the Senate is probably doubtful. So come September 30th, there is going to have to be some, but prior to that, some measure that we would actually have to do to fund the government going forward. You know, my proposal is that we fund everything except for the implementation part of Obamacare, that we fund everything else. We actually have had, with sequestration, we've actually had cuts, really real cuts for probably the first time in 50 years. You know, when you really look at real cuts, not just cuts on anticipated growth, because that's, you know, a cut in Washington, D.C. means that I plan to spend this and we're going to cut back. A cut back home means that I spent this and I'm going to spend less next year. And so we need to take the definition from home and take it to Washington, D.C. So September 30th, or prior to that, probably going up to that, both the House and the Senate will have to act on something in order for our government to continue to be funding. And that's why you continue to hear about a potential government shutdown. But really what I believe that they will have is a number of different options to make sure that our government is funded. I'm hopeful that that does not include something for the implementation of Obamacare. And so that's the September 30th. Then beyond that, because you'll hear it kind of brought, in fact, I read something the other day, is the debt ceiling. That's a different argument altogether that has to do with raising the debt ceiling. I don't see that that actually will happen until the end of October, maybe the 1st of November, as we bump up against the $16.8 trillion debt ceiling that we have. And so that's a different time. One talks about funding for government, the other talks about paying our obligations going forward, but that's the difference in the two. Thank y'all, thank you for your support. I'll come over and answer it personally. That was my last question, and Ed, thank you for all you do.
I have to ask one question. You look good. You look rested. Your tie's straight, your jacket's straight.
Oh, well, good. My wife will approve.
I was going to say, is there one person here that helps get that in order? Pray for us. You know, this is not an easy battle, and I can tell you, but it's a battle and a fight worth having. God bless you. Thanks so much.
We have a platform here that we can be proud of. I'd like to give
in the House. He is the leader on this thing, so I hope you appreciate just how great his efforts are he's defying the leadership. He was polite about Boehner and Cantor. The fact is, they're not for defund. They're okay with the idea of delay, and I suspect that he and I and many of us would also cheer a delay if we could get it. And in fact, that brings me to my first point, which is for FreedomWorks, we have a three-pronged strategy: defund, delay, and defeat. Defund is building up the leverage for the coming negotiation, the standoff, and that's where Congressman Meadows' efforts come in and are so crucial, and that's why we need everybody to weigh in. Get your member of Congress, your senators, sign the letter. Delay means we think we can get this thing delayed, especially the individual mandate, the most hated part of the law and the most important part of the law. If we do that, that's a huge policy victory. It buys us time to fight another day. We think we can get it because we had a vote in the House on delay. 1 year delay of the individual mandate coupled with delay of the employer mandate, which Obama has suspended unilaterally. We got 22 House Democrats on board with that. That's the first time we've ever had a partisan breakthrough on this issue. It was because of the fairness argument. Combine that with the fact that the administration has thrown out the fraud prevention in the exchanges, so you're going to have massive fraud, people helping themselves to government subsidies without their income being verified. Combine that with the massive access to personal data about us in the exchanges through the so-called data hub. These navigators, basically these volunteers, will be paid $20 to $40 an hour to help people enroll, but they will have real-time access to information about our incomes, our employment, our IRS data, our incarceration status, our citizenship status, and on and on. It's the largest consolidation of private personal data in the history of the Republic. So when you combine the unfairness of the individual mandate, the fraud potential in the exchanges, and the personal information, the identity theft potential in the exchanges, I think you can get Democrats even to vote for a delay. That's the weak point. That's what we're pressing on. So I talked about defund, I talked about delay, and the last thing is defeat. And there we are trying to urge Americans to skip the exchange and pay the fine. Now, if you've got good insurance, keep it. Do whatever's best for you financially. But if you're a young adult under 40, the government is trying to trick you, and you're going in the exchange and paying way too much for health insurance relative to its value for you to subsidize other people. That's how this whole racket works. But if people stay out of the exchange and just take their option to pay the fine, it's only $95 for a year, or 1% of your income, whichever is higher, and that's a lot less than the cost of these inflated insurance policies. You can defeat the exchanges. So we call it burn your Obamacare card. Okay? We've partnered with Young Americans for Liberty around the country to hold card burnings. Basically, go out, burn your Obamacare card, do it safely, don't violate the fire laws, but it's symbolic, of course, because there are no Obamacare cards. You print them off our website. They look just like the draft cards from the 1960s, except they say Obamacare, health registration number. And burn it and say into the camera why you oppose government-run health care. We're collecting those videos, and we're going to give an award to the college students who do the best job on that. We're trying to, this is a low-cost way of trying to get the word out that you don't have to obey the individual mandate. You can pay the fine instead. You can get insurance outside the exchange, or you can have employer insurance, Medicare, whatever it is. There's lots of ways to avoid the exchange. So that was a long-winded way of saying defund, delay, and defeat. And finally, I'll let you go with just a plug for FreedomWorks. We're trying to do this because we love individual liberty and constitutionally limited government. That's what we stand for. We hate all kinds of monopolies, government monopolies, corporate monopolies. We're against special favors of any kind. We're for, as I say, individual liberty and constitutionally limited government. So if you don't know about FreedomWorks, take a look. And be sure to look in the middle of this little booklet that turns out to be the centerfold is a picture of me. So, you know, patient-centered care, that's what we're fighting for, among many other things. School choice and fighting against corporate handouts and so on. So, with that, thank you. And, oh, yeah.